Hi, I'm Grace. I'm a fourth semester nursing student, and I will be demonstrating the nursing skill of applying a Foley catheter. Hi, Mr. Jones. I'm Grace. I'm going to be your nursing student today. I will be administering a Foley catheter to you. Will you please verify your name and date of birth for me? Great, thank you so much. I'll raise the bed to my waist, provide privacy, and don clean gloves. Before I begin this procedure, I want to verify three things. I want to verify that there's a physician's order and that I have the correct size of catheter for it. In this case, it is a 12 French. I want to check on any patient allergies, specifically betadine and latex. And then I want to know the last time my patient voided, I want to know the amount, and I want to know the color. Next, I will take the top sheet off of my patient and let them know that I'm going to be exposing them. Mr. Jones, I'm going to be exposing you now, okay? And I will bring a bath blanket with me to allow any privacy that I can. I want to ensure that my patient is supine and that the legs are spread. And an absorbent cloth underneath. Next, I will provide perineal hygiene. Taking 3 wipes and beginning at the meatus, going in a circular motion down the shaft. I will remove my gloves, perform hand hygiene, and I will be placing my kit on the bed to perform this procedure. So I'll take my kit, place it on the bed, and open the flaps respecting my 1-inch margins. Next, I will don my sterile gloves. Also being careful to respect my 1-inch margins of my sterile field. I will glove my dominant hand first, pinching the cuff, and making sure that my hands do not touch the outside of the gloves. And then my non-dominant hand, ensuring that my thumb does not touch the gloves. Now that I have my sterile gloves on, I'll keep them clasped and not let them drop below my waist. Next, I will come over to my catheter kit and prepare everything that I need to touch with 2 hands before I contaminate my hand application. First, I will take my drapes, ensuring that the shiny side is down. And that I do not contaminate my hands. Next, I will take my tray, out of my kit, and and I will open my swab sticks. Get those ready for use. Attach my syringe. And I will also lubricate the tip of the Foley. For a man, it is 6 inches of lubrication. So once I have lubricated 6 inches, I will provide additional cleaning using swab sticks. In a hospital setting, this would be betadine, but for our purposes today, we're using the simulated swab sticks. If a male was uncircumcised, I would want to make sure that I was pulling back the skin from the meatus of the penis, ensuring to put it back when the procedure is done. With the swab stick, I will clean in a circular motion, ensuring that my drape does not fall and contaminate my sterile field. Clean in a circular motion down the meatus, partially around the shaft. And when I'm tossing my swabs, I bring them towards me into the trash, not to pass them over my sterile field. Once I have this grasp on the penis, I do not release it because this is my contaminated hand now, and this one is my sterile one for my procedure. I will tell the patient to bear down and take some deep breaths while I am inserting the Foley. Grabbing the Foley, I will insert it 7 to 9 inches for males, ensuring not to touch the meatus with my sterile hand. And then I will start, once I start seeing urine flow, I will insert it another 2 inches. When I believe I have reached the correct positioning, I pinch the Foley 1 inch away from the entrance, 1 inch away, and insert my balloon with 10 milliliters of solution. And at this point, if the patient experienced any pain, I would want to retract the solution and insert the catheter farther because I may be in their urethra still. Once the solution is injected, I can remove the syringe, tugging gently on the catheter to ensure that it's in the right place. Next, I will make sure that I clean the betadine off of my patient. And then hang the bag on the edge of the bed where it will not get caught, and ensure that the bag is lower than the catheter at all times. At this point, I will also make sure to be noticing the amount and color of the urine flowing into the bag. Next, I will deglove, and for the sake of this video, I'm not going to tear this drape, but I would under normal circumstances. And I will toss all of my supplies. Leaving this just for the sake of the video. And I would also tape this tubing, making sure it doesn't pull too hard. I would do inner thighs or upper thighs, depending on the gender. Ensure they're comfortable. At this time, I would document I would document the patient's tolerance of the procedure. I would document the urine, how much was passed, the appearance of it. I would document the type of catheter that I used, and I would also document the date and time of the application. Next, I will demonstrate the removal of the Foley catheter, which is not a sterile procedure. So I will don clean gloves, placing an absorbent cloth under the patient's rear. Normally I would ask them to assist me with this by lifting up, but you don't have that today. So. Performing hand hygiene, donning gloves, also ensuring that there is a doctor order for removal, and I would want to verify the name and date of birth. Also ensuring that the bed is at waist height, and ensuring that privacy is in place. Reintroduce myself. Hi, Mr. Jones. I'm Grace. I'm your nursing student. I'm going to remove your catheter today. I will encourage the patient to take deep breaths, and that painful urination may occur after the removal for a few days. So I will ensure that I have a syringe in order to remove the catheter. Sorry, Mindy. Ensure attach the syringe, retract the fluid, making sure I have 10 milliliters. And then gently slide the Foley out for tossing. Also ensuring that I'm documenting the amount of urine and the color that's in the bag at the time of disposal. Moving this, ensuring the patient is comfortable, asking how they tolerated the procedure. And then lowering the bed, placing call light within reach, asking them if they need anything, and documenting all the information that I gathered throughout the removal of the catheter.